Good afternoon from Hong Kong, and happy Chinese New Year, Year of the Ox. I am so delighted that Asia Society Hong Kong can bring back our very first guest on this coronavirus update, COVID-19 update, Facts from Hong Kong and Beyond. And today we're doing episode 27. I'm Alice Mong, the Executive Director of Asia Society Hong Kong. And when we started this coronavirus COVID-19 update on February 14th, over a year ago, I have to confess, I thought it would be a short-term project, that we would be doing it for maybe 6 months at the most. And little did I, here we are a year later, and we're really, really grateful for Professor Ben Cowling returning to talk to us about this global pandemic. And Professor Cowling, since then, we've seen him quite a bit in the media, in television, and we're really delighted. We were one of the first to bring this type of programming to Hong Kong online. And since then, we have done many programs online, but this February 14, 2020 was our first. And Professor Ben Cowling really needs no introduction in terms of who he is, and he has been the leader here in Hong Kong in talking and really researching this COVID-19 here in Hong Kong. Professor Cowling is head of Division of Epidemiology and Biostatistics at the University of Hong Kong School of Public Health, and he has been there, came to Hong Kong in 2004, and has really been tackling the issue of viruses. In the beginning was the SARS.
Yeah, I worked on SARS initially, and then flu and other emerging infections the past 16, 17 years.
Right. And well, when we start talking about this topic a year ago, the numbers, we were talking about this earlier, it was not a global, in fact, it was not even a global pandemic. I think I researched, there was only about 50,000 cases worldwide, and most of it was in Wuhan. And it's only, at that time, about 25 countries, so 500 cases were outside of China. And a year later, we know the number, over 109 million, over 2 million deaths. And of course, the U.S., the numbers have also been, I think some of the numbers are coming down. But here in Hong Kong, we also, the numbers have been steadily coming down after Chinese New Year. So one of the things, the main thing I want to talk about today is really the vaccine, the variants, short-term and long-term. What you see this pandemic is going, and kind of what are you working on right now? But let's start off with the vaccine.
Sure.
And everybody, when they know I'm talking to you today, especially my colleagues, my friends here in Hong Kong, when is Hong Kong going to get our vaccine? I know we've heard different numbers, but
so Hong Kong's arranged to get 3 different vaccines. We're going to get an mRNA vaccine, which is produced by BioNTech and brought to Hong Kong by Fosun Pharma. We're also then going to get the Sinovac vaccine, most likely, and later in the year, we're going to get the AstraZeneca vaccine from Oxford University. So that's 3 different vaccines, 3 different technologies. The BioNTech one is ready to come. I think it's in Germany, or it's even in the process of being sent to Hong Kong by plane. And we're ready to receive it. And then I think the government's going to start administering those vaccines around the end of February, the beginning of March. The first shipment may be like 1 million doses, enough for 500,000 people to get 2 doses. And then as time goes on, maybe every month or 2, there'll be another shipment. So by the summer, we should receive a lot of those vaccine that we've ordered from BioNTech. The Sinovac vaccine, I think, is also ready to come to Hong Kong, but the government needs to decide whether they're going to approve it or not. And if that goes through, then we'll also see people starting to receive that vaccine. And with the BioNTech and the Sinovac vaccine, there's actually enough for everybody in Hong Kong. There's 7.5 million doses of each, so that's 15 million doses, enough for everybody, especially since children can't yet receive any COVID vaccine. No vaccines have been approved for use in children anywhere in the world.
I see. And when I look back on our interview a year ago, and one of the questions we had talked about was vaccine, and you had said years. Yeah. And I remember at the time being kind of depressed about it, but you're thinking that, oh, maybe this was going to be like SARS, and by the summer this COVID would be over. But are you kind of surprised at the speed?
I'm really impressed with the speed at which vaccines have become available. I think it really looked like a challenge to get vaccines within a year for COVID. It's a new infection without any previous coronavirus vaccines in humans. And so the technology has been adapted from other infections. The mRNA technology was being tested for other infections. It's been modified to work for coronaviruses and the other vaccines as well. And so it's really impressive that the vaccines have been developed, invented and developed and made and then tested. And usually the development timescale for a new vaccine is 5 or 10 years. And it's all been compressed into just 1 year. So they started trials without having finished the previous ones. Of course, doing it to the very, very high level of safety and security. But really, really rapid vaccine development, and it's really good news for the world that we have so many different vaccines available. So many are looking good as well in the pipeline, Novavax and a few others as well. So it's really very promising that the vaccines will be able to bring an end to the pandemic.
So I'm right now, when I kind of touch upon the global, the vaccine, in researching right now, I guess the #1 country who has gotten 40% of its population inoculated has been Israel. And that has just only been very recent. And so I'm curious, are we going to learn a lot of, I mean, we're obviously already learning information from how fast, the facts from the Israel vaccines. Can you tell us more about some of the stuff that you are learning?
Just in the last month, Israel's managed to deliver an enormous number of vaccines to their population. And as you said, now 40% of the population have been vaccinated. Within the next few weeks, we should see an impact of that on the case numbers in Israel. I'm not sure today, I haven't looked, but my understanding, even a week or two ago, it wasn't that clear that vaccines were having an impact. But right about now, they really should be. And maybe you could get a guest on from Israel to say what's been happening and if they're seeing that, because with 40% coverage and then they're still vaccinating, so they're going to go 50%, 60%, even higher. With the Pfizer vaccine, which is a highly effective vaccine, they should really see herd immunity kick in fairly soon. And then that means that in Israel, they could really think about getting back to normal. If they can get a high coverage with the Pfizer vaccine, it's really good news for them. They don't need to worry anymore about the social distancing measures, maybe masks, travel quarantines, anything else. All the things that we're doing in Hong Kong, we're doing those. If we could get vaccine to a high coverage, we could stop all of those measures.
My understanding is like 80% of over 60s have received both doses in Israel. And you mentioned herd immunity. Well, what is herd immunity in terms of percentage that you're looking at?
So there's two reasons that people might get vaccinated. One reason is to protect themselves. And with these vaccines, they do provide protection. If you're exposed to the virus, you have a lower chance of being infected or getting sick with it. So that's a very good reason to get vaccinated. A lot of people would choose to get vaccinated to protect themselves, especially older adults who are particularly vulnerable to COVID. The other reason, and the reason that public health authorities would like everyone to get vaccinated, is so that we can protect everybody in the community through what's called herd immunity. And the threshold for herd immunity depends on how contagious the infection is. For COVID, with a reproductive number of maybe 3, we think now, that means if one person's infected, they're going to spread to an average of 3 others, unless there's social distancing in place, of course. And so you need to get 2 of those 3 people to be immune, so that one person's only spreading to 1 or maybe less than 1 other, and they're only spreading to less than 1 other. And so the numbers of cases would then decrease. They wouldn't be able to increase if, at least in that case, 2/3 of the population are immune. So if the reproductive number is 3, we need about 2/3 of the population to be immune to stop spread. And that's the herd immunity threshold for that level of contagiousness or that level of transmissibility. But that doesn't mean we need to vaccinate 2/3 of the population. We need to vaccinate more because the vaccines are not 100% effective. Pfizer is 95%. So if we were using just the Pfizer vaccine, we'd need to go a bit above 2/3, maybe to 70% coverage. With Sinovac, though, if we believe the number, and we haven't yet seen peer-reviewed publication, we haven't seen all the information, if the effectiveness is only 50%, then even if everybody in Hong Kong got Sinovac, we would not achieve herd immunity. And that would mean, so just hypothetically, if everybody in Hong Kong had the opportunity to get Sinovac, received it, everybody had their 50% protection, we wouldn't be able to stop the social distancing measures, the restaurant closures, the bar closures, the gym closures, the school closures, the workplace closures, the 21-day quarantine for people arriving. All those measures would be in place for the foreseeable future. So that's a concern with some of the vaccines that are being used, and not only a concern for Hong Kong, for other parts of the world as well, that in order to go back to normal, you need to reach a certain level of immunity in the population, and preferably by vaccination. Maybe in Europe and in North America, they may have a mix of vaccination and natural infections to give them their higher level of immunity, and also maybe they'll decide to just go back to normal anyway. Mm-hmm. And you know, they've already had a lot of infections. They've experienced maybe the worst that they're going to see. So maybe by this summer, by September, we'll see some of those parts of the world just deciding to go back to normal anyway with whatever vaccine coverage they've achieved. But for Hong Kong, that's going to be difficult because we've had very, very few infections at the population level.
Well, I'm curious also, I remember about a month ago when I was talking to your colleague, Professor Fukuda, one of the things I was curious about then was the mix and match. At that time, I think we were all just, you know, maybe not focusing on so much on the mix and matching of the vaccine, but sounds like that kind of study is now being in place. You know, people at that time were worried about the Sputnik vaccine and maybe the Sinovac, whatever. So do you have any knowledge about the mix and match?
So the Sputnik vaccine, which is used in Russia and maybe a few other places, that's already a mix and match vaccine because the first dose is different to the second dose. But what's now being tested is mixing and matching with some of the other vaccines. And it might work out better. We don't know. They haven't been tested like that. All the trials that have been done so far are really Pfizer for the first dose, followed by Pfizer for the second dose. It's possible that a mix and match approach would be better. It's also possible that we might need a booster dose after a year. So maybe we get our first dose and second dose within a month, and then a year later we get a booster third dose, and that could be with a different vaccine, or even with a vaccine that hasn't been brought out yet, like the Novavax. Maybe that would come in as a booster dose. So ultimately, I'm sure we will figure out the best way to get a high level of protection, which lasts for a long time. Right now, we don't know how long the protection is going to last for from vaccination, probably a few years. But I would imagine within a few years' time, we'll figure out a really a good way to give people long-lasting immunity, maybe with booster doses, maybe with another vaccine. Maybe the mix and match would be a good way of doing that.
But this year, I remember getting my flu shot. And because it was highly recommended because of COVID. So I guess I'm curious, with the way this, you know, is no end in sight in some way, is COVID going to be with us for a while? Like we're going to get our annual COVID vaccine like we're getting the flu vaccine? Is that?
So I don't think the virus is going to disappear. I think it's going to be around for a long time. Mm-hmm. But if we've been vaccinated, then I think we'll be safe from the worst of it. And we'll just have to decide to get on with our lives, and you know, maybe we'll get an infection. It hopefully wouldn't be so severe. In vaccinated people, the risk of getting a severe infection is very, very low. At the same time, I don't think we'll need annual vaccination, but maybe every 3, 4, 5 years, at least in the beginning. Maybe later we'll have a new generation of vaccines coming out that last for longer, that provide longer protection. It's difficult to say right now. The priority right now for this year is just to get the initial vaccines out, to get a high level of coverage in places like Hong Kong so that we can think about getting back to normal life.
Now I want to kind of touch upon the variants, you know, the various strains that's developing. And in some ways, it's also impacting the vaccine. Some of the vaccines are more effective, sounds like, with one or the other. And the major variants are the UK one, the South African, Brazilian, and I understand there is even a California one. And today, reading the news, because of the UK strain, I think Auckland went into a 3-day lockdown because the government, you know, they had nothing for a while, but then the UK strain has really concerned the government of New Zealand. So, and then Thailand also, I think, has gotten something recently in terms of the different various strains. So are you, it sounds like with SARS, they didn't take long enough to develop different strains, but this time, a year later, you're hearing how infectious the UK strain is and others, and the South African one wasn't, I think they said AstraZeneca was not as effective. So can you talk about what are some of the strains and what are you concerned about some of these various strains, and will there be other mutations, I guess, as we go along, you know, before?
All viruses will change a little bit over time just because of the way they reproduce in the human body, that they'll maybe find a way in some cases to get around existing immunity or find a way to spread a little bit better. And so it's not a surprise that we have seen some of these variants coming out, like the variants which are a little bit more transmissible or give infection that's a little bit more serious, a bit higher chance of needing to go to hospital, for example. It's a real concern for right now when we're thinking about vaccination, because I mentioned the herd immunity threshold. If the reproductive number is about 3, we need to get 2/3 of the people to be immune. We're now facing a problem where not only is the transmissibility higher for the variants, maybe the UK variant could be 50% or more higher, so it could be above 4. That means we need to get the immunity level in the population above 75%. At the same time, the vaccines aren't as effective at these variants because the variants are slightly different to the viruses included in the vaccines. So it's not a surprise that the vaccine effectiveness will be a little bit lower. Not a lot lower, but a little bit lower. And so we'd have to get a really high coverage of vaccine to be successful in stopping epidemics with some of these variants. And it's really a concern for the coming year. And the variants that we've seen so far are just variants that have emerged naturally in populations where there are a lot of infections, like the UK and Brazil and so on. But once we start seeing populations that are highly vaccinated, like Israel you mentioned, it's possible that we'll see variants emerging from those locations which can escape vaccine immunity. Imagine if there was a variant in someone in Israel which isn't affected by the immunity from the BioNTech vaccine. Suddenly, that's going to have a field day. It's going to be spreading like wildfire because people who've been vaccinated think they're protected, they're not, and they're not doing their social distancing so much anymore because they think they've got herd immunity. And so that's really a concern that we might see a variant just from one part of the world suddenly spreading there and then further afield, and a variant that can escape vaccine immunity. I hope it won't happen, but it's a real concern.
Do you think with all the various variants, I understand when we went on a 21-day lockdown here in Hong Kong, one of the reasons might have been because of the UK variant. So is a current quarantine policy for inbound travelers, is that still applicable? Is that going to change, I guess, with the different variants?
So going back to March last year, we started a new policy of everyone arriving in Hong Kong has to stay in hotel for stay in quarantine for 14 days. Initially, it was home quarantine, and then it changed to hotel quarantine for 14 days. And then in December, it was extended to 21 days. Mm-hmm. And of course, these are only Hong Kong residents coming back because visitors are now banned. It's only Hong Kong residents who can come back to Hong Kong. So the numbers are really, really very low. Other places in the world that have been doing this kind of traveler quarantine, like New Zealand, Australia, Taiwan, Singapore, all those other places have been okay with 14 days. Hong Kong extended to 21 days because there's always a risk of someone having a very long incubation. But 14 days has worked okay in all those other places. So actually, in my opinion, the greater risk in terms of quarantine is hotels are not really designed for this purpose. You think about when you've stayed in hotels, you can't open the windows. The air comes from the air vents in the ceiling, and you don't know where the air's been before it gets into your room or where it goes after it's left your room. It's quite possible that there can be transmission from an infected traveler to the other rooms in the quarantine hotel. And so that would mean that you'd see cases arising after people have been discharged from quarantine. That's happened in New Zealand and in other places. The other risk is, again, hotels are not designed for quarantine. So in Australia, there's been a number of cases of infections of hotel staff in the quarantine hotels. And so in my opinion, the risks in quarantine are actually from the transmission within the quarantine hotels to the other guests and to the workers, rather than someone coming in and then having a really, really long incubation period beyond 14 days, but caught by the 21 days, because that's really unlikely. We don't tend to see that kind of thing happening. So I think the 14-day was okay as a limit, but in the longer term, if this policy is going to go on for another year or two, which it may do, then I think the government could think seriously about more appropriate facilities for quarantine of inbound travelers rather than repurposing hotels. In the early days, I understand it's an emergency, you have to figure out what to do. But if we're going to keep this in place for another year or 2 years or 3 years, maybe we can think about more purpose-built facilities for quarantine of inbound travelers.
Well, a friend is now quarantining in Penny Bay, And my understanding in that facility is quite different than the
so
hotel.
that's a close contact quarantine. That's a different thing. So that means if one of us was a confirmed case, then the Department of Health will investigate who we've had close contact with, particularly not wearing masks. And if you've had a certain duration of contact that's close with a confirmed case, then the policy here is those close contacts go to quarantine. In case they have been infected and don't yet know it, they'll go to somewhere like the Penny Bay facility for 14 days. Since their last exposure, they'll be monitored. And if they haven't been infected, they're fine to go. And if they've been infected, they'll be transferred to isolation and looked after in the hospital or in the Asia Expo field hospital.
I see. One of the things we've been getting questions from the audience. In fact, I really encourage our audience to send their questions to Slido. We already have some coming in, and we're going to turn to that shortly. But one of the question from one of our members who sent me the question earlier, is we already talked about the kind of the inconsistency. Some places 14 days, 21 days, and also the governments. It all seems like the countries this question kind of comes in divided in two. Some countries, like here in Hong Kong or in Asia, the discipline of wearing the mask. That has obviously the numbers. Our numbers are quite significantly lower than those who lacks such a discipline. I think the U.S., unfortunately, the numbers have proven to be very high. But it's just, the big question is, what has been learned from these two extremes this last 12 months?
I think on average, Asia's done very, very well in dealing with the coronavirus. In Hong Kong, we have the SARS experience to rely on. So we've got facilities ready to go for isolation of cases, contact tracing and quarantine of their contacts. And that test and trace has been really important. That's meant that we don't need so much from the social distancing as maybe they do in other parts of the world. At the same time, in Hong Kong and in Asia locations, people have been more compliant. Maybe the government's been able to get people to be more compliant with social distancing recommendations. So a lockdown in Asia really means a lockdown, whereas in Europe and the US, a lockdown is people are supposed to stay at home, but they don't necessarily stay at home. They're not supposed to go out and meet their friends, but in practice, many of them do. And so the effectiveness of measures that are in theory the same has been different in different parts of the world. And for Hong Kong, I think the SARS experience has played a major role in our success here in the past year, that learning from the SARS experience, the government invested a lot in infrastructure, and the people of Hong Kong have a memory of what things were like, and they know how to react. If you remember, in the very early days, there were recommendations not necessarily to wear masks, and there were also debates about whether the border to the mainland should be closed or not. And it seemed like Hong Kong people really knew what the right thing to do was, and took matters into their own hands in some cases by wearing masks, even when it wasn't recommended to do so.
So what, I think you already touched upon this, in terms of what can Asia or Hong Kong kind of teach the rest of the world. Right now, we're coming out of, it seems to me we're coming out of the fourth wave. And if I was talking to friends in the States, they said they don't even have the one, I think they've been this one consistently first wave, one wave. But are we coming out of the fourth wave? And what have we learned from this fourth wave here in Hong Kong, from this last two or 3 months?
So the fourth wave in Hong Kong has been much more difficult to control than the third wave and the second wave. And the first wave, it was really very few cases. So we've had 3 major community epidemics: second wave, third wave, fourth wave. And the fourth has been the largest and the most difficult to stop. And I'm worried about what's going to happen if we have a fifth wave. It's maybe even more difficult, especially if it's with one of these variants that's more transmissible. It may be really difficult with the measures we've used so far, maybe really difficult to stop it. So we should put more effort into preventing infection from coming into Hong Kong in the first place, which the government's doing with the 21-day quarantine, with fixing the loopholes like the air crew and the maritime crew and so on. In terms of what other countries can learn, it really depends. I don't think the same approaches would suit every different part of the world. But I think after this is all over, countries in Europe, North America are going to come and look at what was done in Asia after SARS, and also in response to COVID, and think about what they could do differently. For example, better preparation in hospitals with infection control, stockpiles of masks and other protective equipment that they didn't have a year ago, and all kinds of other public health preparations for a pandemic, because we know these kind of events do happen from time to time. They're not that common. We had 3 or 4 flu pandemics in the last 100 years. The previous coronavirus pandemic was probably 120 years ago, but there was one. And so another pandemic like this could occur again, even in our lifetimes, maybe not, but it's something that governments need to prepare for. The same as you take out insurance on a house or on a car, you don't expect to have an accident, you don't expect to need the policy, but you take it out because if you do need it, it's because something catastrophic's happened. And so that's why pandemic preparedness is so important as an investment for countries to make.
Why has the fourth wave been so difficult and long? I mean,
so when we look back to our third wave in June, July, August, the government came in with a number of measures which were important. The work-at-home policy for civil servants, closing bars, nightclubs, karaoke's where there have been clusters of infections occurring, encouraging people to stay at home more often. And those measures worked pretty well in July and August. We saw the case numbers come down quite substantially. The same measures were brought back again in our fourth wave in November, end of November and in early December. And the measures didn't seem to have as much effect as they did in the third wave. And I think it's because we were looking for the same measure to have the same effect. But actually there's a step in the middle. So there's a government measure, there's the way that people respond to it, and then there's the impact that you observe. And what we've maybe forgotten is the middle part. People have to respond to those government measures. When the government says stay at home more often, people have to do that. And I think in the fourth wave, the public response was not as strong. Maybe there's a bit of fatigue. People are tired of the measures, a little bit frustrated. How much longer is this going to go on for? The consequence is the fourth wave's dragged on. We'd like to get the fourth wave over with so we can have a period of time to relax. But it's been going, and I think the low numbers in the past few days, unfortunately, I think it's not real. I think people have not been seeking care as much as they would have done before Chinese New Year because it's inauspicious to seek medical care after the New Year for the first 2 weeks. And so although the case numbers have been very low in the past few days, I have a nasty suspicion that there's some cases in the community that maybe haven't gone to see the doctor because of the bad luck. And so then there's maybe transmission in family gatherings, and we're going to discover in a week or in 2 weeks' time, when the case numbers go up again, we're going to discover that there's been transmission going on that the government was not aware of. I hope I'm wrong, but I really worry that this is a period of time when people don't tend to seek care, and that's going to pose a problem.
And also, do you think Chinese New Year is also having an impact on China as well? Because, the government has been trying to encourage people not to do the mass migration home and all of that. But, people still, but in some ways, China, because of the various measures and technology and so on, could control. So do you see a spike also coming out of China because of Chinese New Year? In
mainland China, I think the government's preference would have actually been for nobody to travel. And in other parts of Asia, we've seen that happen. In Malaysia, I know they're on a total lockdown. People just can't travel around the country. But in mainland China, maybe they weren't able, or they didn't think they'd be able to stop people from traveling. And so it's possible that if there were just small numbers of cases in one part of the country, now that's going to have spread across to other cities. And we may well see a few outbreaks being detected in the next few weeks. We've heard about a few cases here and there in the mainland. And because they're not having much social distancing, their life is kind of back to normal, it means the infections have an easier opportunity to spread. But in the past 6 months, every time there's been an outbreak in a city in the mainland, the authorities have really clamped down very, very quickly and limited the numbers of infections. So maybe tens to hundreds of infections, but not more than that. They've really got a grip on it very, very quickly. And I would expect the same thing to happen now, even if there are sparks into some big cities. I think those cities will then go into lockdown and the outbreaks will be controlled because everyone in every country in the world knows what can happen if coronavirus is given free rein to spread, and in China it's no different. So they want to crack down on it very, very quickly.
Well, one of the tools I think they seem to be effectively using, the government has, is traveling. In order to get buy tickets, you need to have some sort of travel code proving that you're negative. So in terms of using the technology, it seems like China is kind of ahead, and this is an area where I know Hong Kong, where the government is promoting the QR code, all of that hopefully will go into effect this week. So hopefully that is an area will allow us some sort of freer movement now that, hopefully the privacy issue is addressed, that the QR code, the technology, along with the, all the measures will...
That's right. So going back almost a year, the way that the infections were successfully controlled the first time round in mainland was because of the use of technology, the apps, the QR code, the health code, and also using the CCTV images to find out where people had been, and the mobile phone tracking and so on. In Hong Kong, we do have that app, but the download rate is still very low. I think about 10% of people have downloaded it onto their phones. A lot of civil servants, because it's required to access the civil servant offices. I'm not sure if there'll be as much enthusiasm for the app here. In the mainland, it's kind of compulsory, and the government can really enforce people to do things. So in Hong Kong, we'll have to see what happens, but it's going to be a harder sell for the government here than it was in the mainland to get people to use that. And you mentioned the privacy concerns, but I think key to the use of these apps is that the government is able to access the information. So I heard an interview yesterday where it was explained that the QR code in Hong Kong wouldn't send any information to the government, but then the next sentence from the person being interviewed was that if you've been to the venue where there's been a case, then the government will contact you. So apparently they will have the information, and if they didn't, it wouldn't make any sense because they need the information to know who to phone up to do the contact tracing. And to be very clear, that the targeted measures that we're using in Hong Kong, the contact tracing and the quarantine, is very disruptive for those people who are sent to Penny's Bay for quarantine. But that's a way to reduce the disruption for everybody else in the community. If we weren't doing that, then we'd maybe all have to be under lockdown instead. So I understand the rationale for doing the targeted measures, but in Hong Kong, there's a lot of concern about privacy and personal information.
We have a question here. It's very interesting. Would we be in a better position today if a year ago the world had adopted the quote-unquote non-lockdown, home care, no travel restriction philosophy adopted in the 1957-58 flu, which was not too dissimilar from COVID-19?
It was not really that similar to COVID-19. So the mortality rate for COVID-19 is now established is something around about 0.5%, maybe 0.3, 0.4, 0.5%. And so in a place like Hong Kong, if we did nothing in terms of controlling it, if we let it calm and let it spread freely, we'd expect about half the population of Hong Kong to get infected within the space of a year, maybe more than half. And so with a mortality rate that high, and also hospitals that really can't cope. If you remember in December, hospitals were creaking with 100 cases a day. And if we let COVID spread freely, we'll go thousands, tens of thousands, even hundreds of thousands of infections a week. So the impact would be incredible. I would imagine with free transmission, with uncontrolled transmission of COVID, tens of thousands of people would die in Hong Kong, if not more than that, if not 100. I hesitate to give numbers because it's so scary, but there's no question that we would have to do something. And once the hospitals were full up, the government would have to react anyway. So it's not even a plausible scenario to just let it spread and acquire herd immunity. We've seen the damage that COVID can do in Europe, in the US, with probably 10% of the population of London infected. The hospitals were at breakdown point. And at that point, the government was able to stop it from getting worse. But if they hadn't, the numbers would have gone up and up and up, even higher. So there has been a debate about whether we should just allow it to spread and avoid the economic damage. But I don't think it's a realistic scenario because any government in the world will be forced to act when hospitals are full.
Well, this question is kind of related to that. How to balance the adverse effect of lockdown, really kind of this total closure of society. We're seeing it in business closure and also students learning from home. It's almost been 2 years now, I think, with the students learning from home. How do you balance that with the benefit of health? I mean, and there was also been talk in the U.S., some of these committees would it benefit to have a social scientist on it, and rather than just all scientists. And the government also always have to balance, between, the health issues as well as the health of the economy. How do you see that?
So I work in public health, and my priority is always to do as much as I can for public health, to really focus on health. But I think the government should be served by advisors of different backgrounds, economic advisors, social scientists as well, because there are so many considerations in terms of government measures. But as I said a minute ago, if we get to a situation where hospitals are full up, there's going to be societal panic almost, and I don't think any government would allow that to happen. So their first priority is to manage infections in the community and keep numbers of infections as low as possible, preferably zero, and then deal with the economic implications of whatever measures are put in place. In terms of schools specifically, I have said many times over the past year that I don't think schools need to be closed to deal with COVID. We've seen very little transmission in schools in Hong Kong when they've opened. In June, they opened for a period of time. In November, they opened again for a period of time. There were no reported large outbreaks in schools. There were maybe a handful of cases in school-aged children. 1 or 2 of those were linked together. Most recently, there was an exam where there were 2 people in the exam, and then the whole exam hall, all the children that were in the exam hall were sent to quarantine. I don't think there were any other infections reported in that group of children. And so I think we've been maybe too eager to see schools closed, especially for such a long period of time. And my hope is that in this new year, we'll see schools open much more than before, especially schools for younger children who really need the in-school learning. For the high schools, maybe some of that could be done online. We could do half days and other things. But for kindergartens and for primary schools, I really hope that those will be able to open, because they don't have much impact on spread of COVID, but they have an enormous societal impact. And of course, I'm not saying that there wouldn't be any risk. For any decision, there's always going to be risks and benefits. What I'm saying is that the risk of keeping primary schools closed is probably greater than the benefit of opening them again.
Well, I remember a year ago, I asked you what would you looking into, kind of like one of the concerns and one of the research you were going to look into was the effect of children, COVID on children. And what have you found out this year about that? I mean, I think maybe you kind of already answered it. Maybe it's not as detrimental on the children. So
younger children don't seem to be infected very easily. They can be infected, but they don't seem to be infected so easily. And they don't seem to get very sick. So if I can contrast it with flu, where we know that children can get flu, they can even get very sick from flu sometimes, in some cases, but they also act as a conduit to spread flu in the whole community. And so closing schools for flu really benefits not only the children, who then don't get sick, but also everyone else, because the children aren't spreading it in the community. For COVID, we don't have that latter part. We don't have the indirect benefits because children are not spreading COVID in the community as far as we can tell. And for children themselves, they're not really at risk of COVID anyway. Even if they did get infected, it would most likely be very mild, if any symptoms showed at all. So I think in other countries, there have been reports of outbreaks in schools. In Hong Kong, we've got all these special measures, masks, spacing in the schools, and a lot of attention. And so my opinion is that we don't have a major risk from opening primary schools particularly, because COVID isn't really a threat to children. And opening primary schools in Hong Kong wouldn't pose a risk to the community, because children are not going to act as the conduits of spread to everybody else anyway.
We are getting questions coming in. We have two questions from Martha, but they're kind of related. Are there any credible reports about worrisome side effect from any of the vaccines that Hong Kong will be administering? And also related to that is, what do you say to those who are skeptical about using the new technology, the mRNA technology, which has never been used before? Yeah,
so that's right that the mRNA vaccines haven't been used on a large scale before. They have been used for other diseases. They've been tested for other diseases, but never used on a large scale. But you just mentioned 40% of the population of Israel have received the BioNTech vaccine. And Moderna also have a vaccine which has been given to millions of people already. And we have not seen any credible reports of severe side effects, at least at rates which we would be concerned about. We know that with any vaccine, there's always a tiny risk of some kind of reaction, whether it's an anaphylactic shock that some people might experience, or whether it's some other kind of immune reaction to the vaccine. For other vaccines, maybe 1 in every 100,000 vaccinated people would have such a reaction, maybe 1 in every 10,000. But the risks of COVID are so much greater than the risks of the vaccine that it's really established that the benefits far outweigh the risks. One of the issues, though, we're going to face in Hong Kong is that we haven't faced the risk of COVID. There's been almost no infections in Hong Kong. We've had 10,000 cases in the past year in a population of 7.5 million. So many people in Hong Kong don't even know anyone else who's been a case. I think I know a couple of people that were cases. But really, we haven't experienced COVID ourselves. So maybe when we think about the risk and the benefit, we think the risk of the vaccine, there's a tiny risk of a side effect. And of course, it's quite common to get bruising or a bit of discomfort the day after the injection. So we can tell the risks are there, but the benefits maybe we're not imagining because we've been pretty much free of COVID in the past year because the government in Hong Kong and the people of Hong Kong have done such a good job of stopping the spread. But we can't keep doing that for another year or 2 years or 3 years. At some point, sooner or later, we're going to have to go back to normal. And at that point, COVID is going to spread. So I think now one of the challenges for the government is persuading people about this risk and benefit equation and persuading people to get the vaccine, maybe incentivizing it, encouraging it in different ways. Because if we can't get a high vaccine uptake, we would expect all the measures that are in place today are going to be on and off over the next year, 2 years, 3 years. And that's really a concern to me.
Well, this is kind of related to that. You're a public, you said your priorities, public health, because that's your field. What's your take on whether employers should make it mandatory for their staff to get vaccinated once ready? How do you balance the public health and the personal liberty?
So I think some parts of the world are going to go down that path. I'm not sure if we will in Hong Kong. One of the challenges will be in verification of vaccination status, because it's not always easy to find out if someone has been vaccinated or not. You need to have some kind of vaccination card, which can then be forged. And so if employers start making it mandatory, then it's going to lead to a black market in vaccination cards and vaccination status. If it's done electronically on an app, people are going to figure out how to hack into it and show that you've been vaccinated where maybe you haven't. So I don't know if making it mandatory is the best way to encourage uptake, but I think we're going to see a lot of different approaches being tested out in trying to persuade people to get vaccinated with the vaccines that are very, very safe and effective and would really be the wise thing to do. But sometimes people just, for whatever reason, are hesitant to get vaccinated.
This question from Stephen asks, which of the new emerging COVID-19 variants from places like the UK and elsewhere is most severe and worrisome in your opinion, and should we ban flights there?
So the two questions. So for the first part, the variants that we've heard about, whether it's the variant that was first detected in the UK or first detected in Brazil or first detected in somewhere else in the world, South Africa as well, it's not clear the variants were originally from there. That's just where they were first detected. And we haven't yet seen any kind of ranking of which one's the worst. We just know that each of these variants is on our radar for a reason, mostly because initially it was just detected very infrequently, and now it's become much more frequently detected. It went from hardly ever being detected to now being almost the majority of detections in some parts of the world. And so it must have something special about it. It must be special in some way. So I couldn't say which one's the worst, but certainly each of those variants is concerning. Right now, we have in Hong Kong banned flights from the UK and South Africa, I think. But one of the issues, I think, with that policy is the UK variant's been found all around the world. So if we have an infection coming in from another part of Europe, another part of the Americas, another part of Africa, it could be with that variant. Just banning the flights to the UK doesn't stop the UK variant, because the UK variant could come in on a traveller from somewhere else. So I don't think that particular policy should stay in place for very long. I understand why it was put in place at the very beginning, but now the variants can be found in so many different countries that unless we're thinking of banning Hong Kong residents from coming back at all and just closing the border, which I don't think is feasible or legal, I don't think we'll see that kept in place for very long. I think the ban on people from the UK and South Africa will have to be lifted, and we'll have to put our trust in the quarantine system.
Even, I understand in UK now, they have to quarantine in hotels.
Yeah, so the UK, after having the UK variant starting there, they're now thinking about having the quarantine for people from other parts of the world, like South Africa, where there's variants of their own, because they don't want those variants coming in. But in the UK, they're going to have the same problem. The Brazil or the South Africa, whichever variant, could come in from a third country. So even if you force people to quarantine from some locations, it doesn't really have much effect. And there's so many infections right now in the UK that I think that quarantine is maybe for political reasons rather than for public health reasons.
I see. We have a question from Debbie. Debbie is asking about schools. What if schools have stayed open at the height of the waves and spread to their parents and grandparents? I think she's saying, don't you think it's the closing of schools has been a success story?
So if we look back into June, when schools were closed in the third wave, but not at the beginning, and also in November, they were closed in the fourth wave, but not at the beginning. In both cases, there were very few infections in school-aged children and no evidence of transmission to their parents or other family members. And we're talking about a very, very small number of cases. So, of course, there's a risk that those kind of scenarios would happen, that there'd be a small outbreak at school and transmission would occur back to the family members and even into the community at large. But at the same time, there's hundreds of thousands of children who are missing out on school, missing out on seeing their friends, missing out on learning at school, all for the sake of a handful of prevented infections, perhaps. So we have to weigh up the risks and the benefits of all the different measures. And I think, in general, in the past years, it would have been better for Hong Kong if schools had stayed open. Maybe at the peak of the third wave, at the peak of the fourth wave, we could have envisaged schools being closed for a few weeks, 2-3 weeks, but certainly not for the majority of the year.
Well, she has said, Debbie, same question, similar, she said she had read somewhere that kids can carry a COVID viral load 4 times that of adults without showing symptoms. Was that
true?
That's
right. So children, when they get infected, they're less likely to show symptoms, and they're actually less likely to get infected in the first place. And because they don't have so many symptoms, it's thought that maybe they won't be so contagious. So even if they've got the virus in their body, it doesn't have as much opportunity to get out and infect other people, because it's the symptoms, like the coughing or the runny nose, that helps the virus to get out of the body. But I'm not saying that the children cannot spread infection. We've seen. I mean, one of the earliest cases that we knew about was the cluster of cases in Shenzhen reported by the Department of Microbiology in Hong Kong University in the journal The Lancet, where there was a cluster of cases, including a child. So we knew from the beginning that children could be infected and could also, in theory, transmit infection. But school closures have an enormous social impact, and I think we need to be careful about using them too freely.
Here, another question. This is from Anonymous. Do you foresee a 5th wave happening in Hong Kong? And if so, when? And how would you compare it to previous wave we've experiencing? And now that we're kind of hopefully coming out of winter, so would it be less or more?
So a 5th wave is inevitable, as the same as the 4th wave was inevitable and the 3rd wave was inevitable. I hope that we'll get the numbers of infections in the 4th wave down to 0, and then we'll relax the public health measures in Hong Kong. We'll relax the social distancing, maybe allow larger groups to gather together again, and bars and karaoke's and all of that will be open. But sooner or later, infection will get into the community. We've seen it in every part of the world that's been successful in having case numbers of 0. In New Zealand right now, you mentioned in Auckland, they're having a lockdown because of local cases. And in Australia, in Taiwan, in Singapore, they've all from time to time experienced local infections after a period of calm. In Hong Kong, no different. If the government acts more quickly, like you mentioned in New Zealand, if the government acts more quickly in Hong Kong, maybe the 5th wave would be a really small wave. My concern is that we might have a 5th wave with a variant, like the UK variant, the South Africa variant, which is more transmissible and more difficult to control. And in that case, maybe it would even be more difficult to stop than the 3rd wave, and the 4th wave might ultimately have greater impact. It really depends on how quickly people change their behavior, how quickly the government issues its public health measures, the working at home policy, and the other measures that have been successful in the 3rd wave and the 4th wave. And as for when it would start, it's really difficult to say. I know the government's talking about relaxing the social distancing measures maybe by next week. I think that's really, it's a risky time to do that. As I mentioned to you, I think the case numbers in the last few days have been artificially low because people haven't been seeing the doctor. And I would expect the numbers to come up next week because of mixing at Chinese New Year and because the numbers were really higher anyway. So if the measures are relaxed next week at the same time as we have increasing case numbers, that would already be the start of the 5th wave, unless the measures are tightened again immediately, and then it would just be a blip. But really, it's going to be a tough balancing act for the government, in the coming 6 months, as vaccines start being administered, people are going to want to relax the social distancing measures, but we won't be able to until at least after the summer and until maybe September. And that's if we can get a high vaccine coverage, particularly with the BioNTech vaccine. If all the Sinovac is snapped up immediately, if all 7.5 million doses, then I would actually be a little bit worried that that would prolong the time that we have to go through these social distancing measures, because that particular vaccine is not going to give us herd immunity. And if we don't get herd immunity, we're going to need the social distancing measures and the travel quarantine and all the other things.
Well, this question is from Anonymous, maybe not in your particular area of expertise, but any insight on how this year's long pandemic has impacted the state of mental health in UK and globally?
So it's not my expertise, but I'm sure there's been enormous impact on mental health from so much isolation, loneliness, people not able to see their friends and their families. It's been a really tough year, and it's not over yet. We can see the end of the tunnel. We can see the light at the end of the tunnel, but it's still quite a way to go in this pandemic. So it's really an enormous impact. And of course, not only on mental health, but also on lots of other things, on chronic conditions where people haven't been able to see their doctor as often as they would have. Surgeries have been cancelled. And then the economic impact and the social impact. So this pandemic's had really an enormous impact, and I think everyone's going to remember what they were doing in 2020.
Well, I seem to remember your colleague, Professor Leung, said this is a marathon, not a sprint. And it sounds like, what stage of the marathon are we in? Are we halfway through?
For Hong Kong, I hope that we're halfway through, but it's all going to depend on vaccines and how much people are willing, so the proportion of the population that are willing to receive vaccines in the coming 6-9 months.
Okay. And right now, let's talk about the long-term and short-term. So you kind of already answered it. Hong Kong, the next, I think a lot of people are not going to plan on traveling until probably, for me, in the summer, July. Hopefully by then, vaccine will be here. So that's kind of, I think people need something to look forward to. So I guess I wanted to kind of give our audience something to look forward to. So in Hong Kong, do you think by summer we will kind of be really out of hopefully with that vaccine? What do you think?
I'm sorry to say that I don't think that's likely. I don't think it's likely that we'll be having summer holidays. Only people who are willing to spend 21 days in quarantine when they come back.
Still 21 days?
I fear so. I don't think 21 days is necessary. I think 14 days would be sufficient.
Right.
But I think we're going to see quarantine on people who return to Hong Kong. Even vaccinated people, we're going to see quarantines in place for quite some time. Because even after we vaccinated a lot of the population, we're still going to want to keep the infection out until we can be confident that it is not really a threat anymore. And so that may be for another 12 months or longer. In terms of the social distancing measures, I think they'll be on and off over the next year. If the numbers of cases are going up, then of course the measures will come in. But then when the numbers of cases are down to a low level or zero, then we'll see a relaxation, just like we did after the third wave. And hopefully that can be for a longer period of time. In terms of something to look forward to, maybe summer 2022.
Oh, no. Oh,
yeah, I know it's really hard to imagine, but I don't think we're going to see enough vaccines coming into Hong Kong with a high enough coverage in the next 6 months that we could be confident about going back to normal by then. It's really tough because I think other countries will be, and one of the pressures then on Hong Kong will be seeing countries around us allowing visitors to come in, economies opening back up again, maybe because they've achieved a high coverage. So Israel could be back to normal within the next few months, welcoming visitors. They don't mind who comes, who goes, because the community's got herd immunity. So even if there are infections, they'll be mostly mild, and the economic benefits of opening back up are really, really important.
Then let's talk about the travel bubble locally then. And I know the government and others really would like us to travel within, Macau, China, opening that up. How likely is that going to happen in the next couple of months?
I think we heard discussions about travel bubble with Singapore, which got burst at the last minute because of infections on the Hong Kong side. And if the discussions on that were to restart, I guess it would be burst from one side or the other. So having seen the bubble burst, I think people may be more reluctant. Like if they'd gone to Singapore and then the bubble had burst and they're suddenly stuck there and having to face a 21-day quarantine when they come back, I think people are going to be less enthusiastic about it now than they would have been a few months ago. For the mainland, because their vaccine coverage is going to be low for a long time, I think the authorities there are going to be very, very cautious. I would imagine the travel quarantine being in place in the mainland for much longer than in many other parts of the world. And in the mainland, they're also using the Sinovac and the Sinopharm and some other inactivated vaccines, which don't have such high effectiveness and will not give herd immunity. So I suspect that in the mainland, they may be closed to the outside world for years. And so we could choose to join their bubble. We could choose to be part of the mainland Chinese bubble. In other words, we could have free travel between here and there as long as we maintain 0 cases and they maintain 0 cases. But I think for Hong Kong as an international city, there'd be a lot of attraction to opening up to the rest of the world, but still having a barrier with the mainland, with a quarantine either way. But that may be a tough decision for the government if they're faced with which side of the bubble to be on. Because in the mainland, I'm really concerned that they're not going to reach a level of herd immunity anytime soon. And so they won't be able to risk infections coming into the community. They'll be using testing, just like they're doing now, a lot of testing, a lot of monitoring, but no free travel.
Because we heard Macau has already started their vaccine program, and their numbers were very low anyway. And China was supposed to get 50 million of their citizen, that was the target by Chinese New Year, 50 million,
yes.
but they fell short.
Yes.
And so it seems like it's kind of sporadic, and that nobody is, is doing things right. So it sounds like even among the, travel bubble.
In the mainland, there's 1.4 billion people. That's an awful lot of vaccines to manufacture and to administer to 1 billion plus people, even if at 1.4, to 1 billion or more people. So you said 50 million before Chinese New Year. That's a long way to go before they could think of reaching a high coverage and then having herd immunity. And the same as I mentioned for Hong Kong. In the mainland, they haven't really seen the impact of COVID, only in Wuhan. I think almost all of the confirmed cases in China have been in Wuhan. So really the rest of China, the people there are going to need to be persuaded to get vaccinated when they don't see the risk. They don't see the danger of COVID.
I think this is my last question. We have only 2 minutes left, but you talk about, as a public health official, you probably have never seen anything like this in your career. And what have we really learned this last year? And what are some of the things that you're worried about in terms of long term? And what can we learn from this global pandemic that, it's last time something like this happened was 1918 when 50 million people passed away. But this time, fortunately, the numbers is still around 2 million. But what are some of the things that you're kind of excited about learning about this? I guess I'm trying to end on a positive note, but the positive and the negatives of this global pandemic. So
I'm not a health official. I'm a scientist, so I study these things. And scientifically, it's fascinating to see how this new infection is spreading and what's the effectiveness of different measures. We're in a much better position now than we were a year or two ago to respond to pandemics. And so I think two or 3 years ago, I was commissioned by the World Health Organization to help with some guidelines for what kind of measures would be used in the event of a flu pandemic, depending on the severity. And the severity scale we had was like a hurricane scale, like category 1, 2, 3, 4, 5, and 5 is the worst. And COVID-19 is off the scale. It's much worse than a category 5 flu pandemic was envisaged to be. And so that means the public health measures that have been used are everything that people can think of. Everything, so stay-at-home orders and lockdowns and cordons around cities and travel quarantines and everything. And so scientifically, there's an enormous amount that we can learn and that I've been working on learning and still a lot more to learn. But as a member of the community, it's really horrifying. I never imagined this kind of thing could happen. I did a lot of research on the flu pandemic in 2009, which was really so mild, it was hardly a pandemic at all. And I was thinking to myself, maybe that's what flu pandemics are going to be like now. And so, it's scientifically interesting and we don't need to worry. But our lives have changed in the past year as a consequence of COVID and maybe never will never be quite the same again. But on a, I don't know how to end on a positive note, is still, hopefully all the things that we've learned from COVID-19 would mean we can reduce the risk of this happening again, and we'll be in a better position to deal with it if or when it does happen again, because pandemics are going to happen from time to time.
I think you're right. I remember, I think our chairman, I heard Ronnie at a conference, this was about 2006, and somebody asked him what was his number one worry, and at that time he said global pandemic. In 2006, I think, or no, it was 2016, and everybody kind of laughed, and now fast forward 2020, what a year. And we hopefully will learn from this. And also, I think my optimistic view is that collaboration, and from the things we're seeing from this pandemic is, many of the vaccines we talked about has been collaborative efforts with countries, and also sharing information, even the way how fast Israel has just jumped on it. And my understanding is one of the reason was they agreed to be kind of the guinea pig, sharing that information globally. So technology is another area that we've also kind of, I can't imagine if we did not have programs like this or internet, that kind of, we would have been even worse, I think. So I think one thing I learned is human beings, we're social animals. And if we can't connect live, we can still connect via technology. And this Zoom a year ago, never heard of it, now is in our lives. So I think it could be worse. But I think I want to thank, again, Professor Cowling, your work. And it sounds like you're going to have a lot of information to work on for the rest of your career to study from this global pandemic. But I think, I can see the light of the tunnel. And Hong Kong, with the caseload that we have, 10,000, my goodness, with 7 million. And hopefully within a few months, vaccine news, we will have more to report from Hong Kong about Hong Kong's successful implementation, beginning of vaccine here in Hong Kong, and we can also share that information with the rest of the world. But I want to thank our audience for joining us, and something to look forward to. In March 2nd, 2021, our Zurich Center is going to do an Oxford-style debate. Will East Asia lead the way beyond this pandemic? And the premise is that there's a lot to learn from Asia, from this global pandemic, in some of the policies. So please join our Asia Society Global Network for the March 2nd program. This program will be free for members, and I think a slight charge for non-members. So please join us. And we hope the government, there's a possibility of the Asia Society Hong Kong Center opening to the public on Friday, this coming Friday, February 19th, if the government decides to, so stay tuned. If not, we continue to bring you program online, and we're going to be doing a lot more of this COVID-19 update. Today, we'll conclude episode 27, and you'll hear more about episode 28 in the days to come, and some of it will be in collaboration with our other Asia Society centers. And again, I want to thank those of you who joined us from all around the world, as well as Hong Kong, for this program. And again, thank you, Professor Cowling, for your hard work. And we look forward to bringing you back to enlighten us on this topic that has been plaguing us for this a year. But hopefully, same time next year, we will have a different viewpoint, and we've already also have learned more from this global pandemic. So thank you, and good afternoon from Hong Kong.